Hi everyone, and welcome to our very last video in the Navigating Early Childhood series. For this last week, I figured we would just talk about occupational therapy and its role with Down syndrome, specifically in these first 5 years. I'm an occupational therapy student. As you guys know, I feel like I've said that 5 million times over the past 6 weeks, but I do want to just kind of do my part to explain what occupational therapy is, because a lot of people don't actually know what it is until they're actually involved in it or one of their loved ones receives occupational therapy. And so I just wanted to do a brief overview of what it is, how it might be different from other therapies. A lot of people think it's like physical therapy, and I just want to kind of eliminate some confusion and advocate for the profession that I am entering. So if you don't know already, my name is Lydia, and once again, I'm an occupational therapy student at Baylor University, and let's jump into this week's topic. Let's start off by kind of talking about the basics. The first thing is that occupational therapists work with people across the lifespan, meaning not just older people or not just kids with disabilities, but truly anyone of any age could receive occupational therapy services. The next thing is that people with and without disabilities receive occupational therapy services. Basically, occupational therapists are concerned with someone's ability to participate in meaningful everyday activities, or what we like to call occupations. So this includes any of the activities that a person wants, needs, and is expected to do. So if for some reason someone is having trouble completing the things that they want, need, and are expected to do, they could be a candidate for occupational therapy. Okay, so in most cases, you do need a referral from a doctor to receive occupational therapy. And so I am going to use the example of a child here just because we are focusing still on that early childhood phase. But after a child is referred to OT services, a therapist will evaluate them. So they'll meet them for the first time, get familiar with them, and they'll start to think about why the child might have been referred and what things they're going to work on in therapy. So the therapist might use assessment tools, they might play with them a little bit, and they might just observe the child to identify those areas of development and skills that they could be working on. Based on their findings, they create goals and a treatment plan for the child, and that includes how often the child is going to receive services and where, etc. And then children might receive occupational therapy services at home, like we talked about. Early intervention, that's likely in the home. They could also receive OT at school or just at a clinic in the community. There's various settings that they could receive it in. So the American Occupational Therapy Association has this document basically that outlines why we are unique from other professions and what we do that other professions don't. And so something that I've heard a lot is like, oh, do you help people get jobs, because they hear occupation? Or they're like, well, aren't you basically a physical therapist? Or things like that. And I feel like these terms kind of really help us distinguish ourselves. So of course, the big idea of occupational therapy is, again, we're concerned with someone's ability to engage in their everyday activities, or what we call occupations. And these are just some approaches that we might take with that big idea in mind. We're going to look at promoting health within people's occupations, establishing or restoring skills. If someone has lost skills, we can help them get them back. If someone is maybe a little bit delayed in getting skills, we can help them establish those skills. That might be what we do a lot with young children, is we kind of help them establish the skills that they need. Maintaining skills, we help those as well, skills that have already emerged, and we help people not lose those skills. We also look at activity modification. If someone is struggling with a certain activity, what can we do to maybe make them more successful in it, and what can we change? And then we're, of course, concerned with prevention, and of course not making any issues worse, and also taking steps to prevent those things from happening. So I think that going through those approaches on the last slide kind of helps you think about what an occupational therapist is concerned with, what they're thinking when they're working with someone. They're thinking about developing new skills, modifying the activities that they're doing. They're thinking about promoting health in everything that they're doing. And this side is really concerned with more, what does an occupational therapist actually do? So these are some types of intervention that they might do with a young child. The first is, of course, just using occupations and activities. If someone's having trouble with a certain activity, it makes sense that in therapy, you should use that activity and work on it with them in an environment where they're supported and where you can guide them and where you can really just help them be successful. Another part of occupational therapy practice is using assistive technology, which we'll talk about, but basically different tools and also changing the environment, again, so that person can be more successful. Occupational therapists are also concerned with self-regulation, which we'll talk about on its own slide. Also, education and training. I'm sure a lot of you have had occupational therapists for your child that are great at teaching you stuff and showing you how to do certain things that you wouldn't have known how to do without them. And then also, advocacy is also a huge part of being an occupational therapist. Okay, so we talked about how occupational therapists might use occupations and activities to work with children, but what exactly are they going to be working on? Through occupational therapy, children with Down syndrome may work on what we call activities of daily living, and it kind of sounds like exactly what it is. Activities that you do every day and that are concerned with yourself. So things like dressing yourself, including using zippers, buttons, snap closures, tying your shoes, hygiene tasks like brushing your teeth and other self-care, fixing your hair, toileting independently is something that is an activity of daily living. Feeding is also a occupation that occupational therapists often work with, especially with this Down syndrome population, because they're low muscle tone, which if you watched my video on health and development, or even if you didn't, I'm sure that by now you are aware that children with Down syndrome often have low muscle tone and weakness. And so that can really affect actually the muscles of the cheeks, the tongue, and the lips, and that can make feeding more difficult for them. So that's often something that you'll see occupational therapists work with a lot in those first few years with these children is feeding. Getting them to use utensils to self-feed, learning how to drink from cups, even tolerating certain foods, maybe if they have some texture preferences and things like that. And also just oral motor exercises for the mouth to help strengthen it and get it ready for food. And then another activity of daily living that we focus on is functional mobility, which is just a fancy word of saying moving around, walking, moving from one position to another or one place to another. So rolling over, crawling, walking, jumping, running, all the things. Continuing with our occupations and activities, education is also an occupation that therapists will often address, especially in the school system. In the school system, they're going to be concerned with making the transition to a classroom, working on problem-solving skills, fine motor skills that are used for schoolwork, like cutting with scissors or holding a crayon, visual impairments, or just really anything that affects their academic performance. And I do want to note that if they are receiving therapy in schools, they don't just kind of work on anything. They are working on the goals that are indicated in the child's individualized education program, which we briefly talk about in the early intervention presentation if you haven't checked that out. But basically it outlines the student's education program, exactly what it sounds like, cater to their needs. And so therapists also have to kind of fall in line with what is outlined in the IEP within the school. Therapists might also work on sleep because we know that children with Down syndrome are prone to experiencing disruptions with sleep. So they might work on helping minimize those, establishing a really solid nighttime routine, things like that. And then also social participation. A lot of what occupational therapists do with children is teaching them social skills, showing them how to engage with others, and just working on exhibiting socially appropriate behavior. Now, we talked about fine motor skills in the context of education and in the school, but definitely all OTs are going to be concerned with someone's ability to engage in fine motor activities, which are activities that require the use of the small muscles of the hands and the fingers, like we mentioned, cutting with scissors or holding a crayon. And we also know that the low muscle tone and that kind of looseness in the ligaments in children with Down syndrome make these skills harder for them. In addition to that, a lot of them tend to have shorter hands and fingers that can also affect their dexterity or their ability to move their fingers in different ways with objects, and thumb opposition, which is just moving your thumb kind of across your hand or to other fingers. If you have a shorter thumb, that kind of range might be limited. So in therapy, you might see children do a lot of activities with small objects. Of course, this doesn't pertain to them when they're like babies and things are a choking hazard. But as they get older, they might use more things like beads, little pom-poms, strings, putty, things that seem kind of random, but they're all small objects that kind of help them fine-tune those skills. Occupational therapists might also do a lot of sensory activities, which are just activities that engage the human senses. This includes the 5 that we typically think of, but also a few other ones that are less talked about. These are basically just to help minimize issues with sensory processing. We've seen, like how we mentioned with feeding, some kiddos might have sensitivities to food textures. Some kids are sensitive to loud noises. Interesting enough, that low muscle tone also tends to affect their sensory processing, specifically with the sense of proprioception, which is basically your awareness of your body and the space around you. Children with Down syndrome tend to have trouble with this, and a lot of times you'll see them kind of have difficulty determining how much force to use. For different tasks, they might accidentally drop things or knock things over. I know my sister, for a little while, we had to really work on her hugs because she would use a lot of force when she hugged someone, just not knowing that they're doing that. So sensory activities can help kind of regulate that and kind of tone those down a little bit. Another thing that's interesting that you might not know is a proprioception issue can be grinding of the teeth, which is really common for children with Down syndrome too. They kind of do it in an effort to increase that input from their body and from their bones. So therapists might use things like weighted vests or different exercises to kind of use that need for that input and kind of minimize the issues that they're having. Now we're going to talk about assistive technology and environmental modifications. This is another way that occupational therapists help individuals be more successful. Now, assistive technology kind of sounds like robots and fancy computers, but it really isn't that. It's as simple as any tool that helps individuals be more successful in their occupations. So this can include things that are pretty low-tech and things that are pretty high-tech too. An example of a high-tech assistive technology device is maybe an app that uses speech recognition and types out something for you. That is a pretty high-tech way of helping someone be more successful in the activity of typing something out or sending a text message or something like that. But it could also be as simple as using one of those plates that suctions to the table instead of a regular plate. If someone's having trouble during feeding and their plate's kind of going everywhere and it's just a mess, that simple change of just using that plate and using that tool as a way to make the occupation just a little bit easier for that person, that's an example of assistive technology. Another thing that occupational therapists frequently do is make changes to the environment around the person to help them be more successful as well. So, for example, if a child at school is having trouble with transitions because they get no heads up, the next thing they know, they're getting told to get out of their chair and go to this room and go to that room, and it can be a lot. If they're having trouble with transitions, an occupational therapist might tape a visual schedule to their desk. That way there's something new in their environment that they can look at, and it might help them make those transitions easier. Another OT intervention that's huge, especially for kids, is self-regulation. This is basically promoting that emotional stability that one needs in order to do activities. Getting in that space where you're ready to do something, you're focused, you're calm, and just kind of knowing yourself and being aware of what your emotions are. So this is something that I see used a lot, especially for school-based therapists or just any therapist that works with children, something called zones of regulation, which is basically where different emotions are associated with a different color. And no color is bad in this, but it just helps children build that awareness of what they're feeling, and it helps them regulate their feelings instead of just being at the mercy of them and just kind of being all over the place. They can determine the zone that they're in, and based on their context, where they're at, maybe they might need to modify their behavior a little bit. You know, you're feeling angry, but in the classroom you can't scream. So it's okay to be angry, but we're not going to scream. So what are you going to do instead? That kind of thing. And really just helping children build those skills to help them be successful in their activities like school and anything else. A part of occupational therapy that I'm sure you all are pretty familiar with, if you've gone through some sort of OT with your child, is education and training. Especially during early intervention services, you might have had OT show you how to do different exercises or how to use different tools, and that's a huge part of what occupational therapists do, especially with children with disabilities. Therapists are often sharing knowledge with their clients, especially parents if the child is very young, and they're helping them kind of have the tools to shape those habits and routines that will ultimately improve the person's performance. So again, during early childhood, much of this is aimed towards the parents, and there's a lot of focus on the parents knowing how to work with their child. An example is that an occupational therapist might show parents how to do oral motor exercises for their baby that has difficulties with feeding. They might show them how to do it and then say, okay, you try, and kind of transfer those skills so that the child can be successful when the therapist is not there. And finally, OTs do a lot of advocating, just like we talked about in that last video about how parents are advocating all the time for their children. Similarly, occupational therapists and of course other health professionals as well are always advocating for their clients, or should always be advocating for their clients. This includes additional services. Maybe a therapist only sees a kiddo once a week, but they really think they need to be seen twice a week. They might advocate on behalf of that child to someone else who has more control over the situation and say, hey, I really need to see this person 2 times a week because of this. And that's a way that they help get more services for their patient, or they might help get some equipment. Maybe in a hospital setting, if a child really could benefit from an adaptive tool, the therapist might go to the hospital and say, hey, we really need to purchase this for this patient. They could really benefit from it. They might also advocate on their client's behalf to other professionals, like a doctor. They might say, hey, doctor, I saw my client do this in therapy, and so based on that, I really think XYZ. And they're kind of that bridge from patient to other professionals, even teachers and school administration. They can really advocate for their client's behalf in those settings. They also help parents in their advocacy efforts, especially early on. Therapists can be a really great resource for parents. They can help inform them of maybe some resources that they didn't know existed. Hopefully you've had a really great therapist that has been able to just tell you about different opportunities that you didn't know existed, and therefore they can help you advocate for your child. Finally, here I have some resources listed that are related to OT. The first one is a website called the OT Toolbox, which is actually well known for being a resource for therapists themselves, but they do have a whole section of their website dedicated to tools for parents, and I would really recommend checking it out if your child is already in OT, or if you have questions about development or just different skills, that kind of thing. I would really recommend checking out this website. There's also a really cool organization called Zoe's Toolbox, and this is especially important if maybe you're expecting a child or your child is still under 2. They provide early developmental therapy tools to families in the Down syndrome community specifically. It's really, really awesome. Started by an OT, and I just love what she's doing, so definitely check them out. I think there's a wait list to get one of these toolboxes, but definitely worth checking out. I've also put the link for the program search for ACI. If early intervention is something that you're not yet involved in, definitely check out which program serves your area. And if you want more information on that, I have a video on early intervention. And then, of course, I've mentioned that the Down Syndrome Association of Houston does have community groups, and that's a great way to get therapy recommendations from other parents that have gone through this and that can recommend some really awesome professionals for you. Here are the references that I used for this presentation. Thanks again for listening. I really appreciate each of you that take the time to watch these videos, and I hope that it was helpful for you. If you do have something that you'd like to discuss with me further, you can email me at lrodriguez@dsah.org, and thanks for watching.